Another option that women can do is to join the DOMINO scheme in the Cork University Maternity Hospital. DOMINO stands for Domiciliary In and Out, and it is a scheme that is aimed at low-risk women who live within a 15-kilometre radius of the hospital. Women who join the scheme are aware that you're aiming for a normal, natural birth, and we have a very good rate and outcome with it. The scheme has been going for 6 years, and 92% of our women have a vaginal birth. And by day 5 postnatally, 99% who start breastfeeding are still breastfeeding whenever we discharge you at day 5. So what else happens with the DOMINO scheme is that the team of midwives look after you antenatally. It is a women-centred service, and it is a midwifery-led service. So you see this team of midwives, small team of midwives. We usually would do your antenatal classes as well, parent craft classes, but we do your antenatal care. We are the midwife who looks after you whenever you come in labour. We assess you in labour. We bring you to the labour ward. We are there with you for your birth, and then you go to the postnatal floors for 6 hours. You and your baby are checked out, and then you go home. Once you're at home, the DOMINO team visit you until day 5, and then we discharge you to the community, to the public health nurse and the GP. If you are interested in more information on DOMINO, please contact your midwife at your clinic or phone up the CUMH and inquire.